Assalamualaikum and greeting everyone. I am Nurul Izzah AZIZAN, Bachelor Student of Food Technology Semester 7. My supervisor is Associate Professor Dr. John Tang Yu Huat. Today, I am looking forward to present my final year project proposal about efficacy of antibacterial and normal liquid hand soap on hand hygiene. This is the outline of my presentation. Chapter 1 is include background of study, problem statement, significance of study and objectives. Chapter 2, I will go through literature review of my topic. Next, for the chapter 3, I will present methods that I use in this experiment. Then, chapter 4 is about expected outcome that I will get from my study. Chapter 5 is the table of my Gantt chart to plan and scheduling my research. And lastly is references that I referred the most to find information of my study. This slide, I will present background study of my project. Hand soap are potassium or sodium salts of fatty acids that are water soluble and have important surfactant characteristics. Hand soap come in a variety of forms including liquid, bar, antibacterial and normal soap. However, in this project, I will focus on two types of liquid hand soap, which is normal and antibacterial. According to the World Health Organization, normal soap is defined as detergents that do not contain antibacterial agents or may only contain them as preservatives. On the other hand, antibacterial hand soap is the soap that contains antibacterial agent in the sufficient concentration to inactivate bacteria. Moreover, both antibacterial and normal liquid hand soaps have bactericidal properties that are effective at removing harmful bacteria. The next slide is problem statement. The problem statement of my study is the research on the effect of different hand washing time durations with different types of liquid hand soaps on hand washing effectiveness, if is scanty if any. In addition, it is still underexplored on how often people should wash their hands after touching foods and fomites. Furthermore, many people are unaware of the importance of hand washing in the prevention of infection and foodborne illness. Next, the other problem is increased media attention on antibacterial soap being superior to normal liquid hand soap has raised consumer expectations of antibacterial soaps. However, the prolonged use of antibacterial products has been shown to the destruction of normal skin flora. Now, I will present the significant study of my project. This study provides the information on the comparison between the antibacterial soap and normal soap on the hand hygiene. The data will be important for the consumer whether the antibacterial soap is necessary to ensure hand hygiene. Moreover, the different time duration during hand use on normal and antibacterial liquid hand soap also has been compared to provide information whether it has impact to the hand cleanliness. Besides, hand recontamination data after in contact with fomite or food is important to estimate the frequency of hand washing. It is also set a baseline for industry to ensure the frequency of hand washing needed after food handling. The objective of this study is to determine the efficacy of antibacterial and normal liquid hand soap on hand hygiene. Next, the second objective is to investigate the effect of different hand washing durations on the effectiveness of hand washing with antibacterial and normal liquid hand soap. Lastly, this study is to determine hand contamination after in contact with fomites and food. Now, let's take a look at the literature review of my study. Hand hygiene has long been regarded as the most important preventive measure against nosocomial infections. Hand hygiene failure is thought to cause the dispersal of multi-resistant microorganisms, and it has been identified as a major contributor to foodborne outbreaks. However, hand hygiene can be accomplished through soap-based hand washing to remove or killing the bacteria. The Centers for Disease Control and Prevention (CDC) and the WHO recommend many strategies to improve hand hygiene, and one of it is October 15, 2008 as the first Global Hand Washing Day with the goal of promoting a global culture of soap washing. This slide is about hand hygiene and its impact on disease transmission. Hands are the single most important transmission pathway for gastrointestinal infections, respiratory, and skin infections since they come into direct touch with organs which are the mouth, nose, and conjunctiva of the eyes. Harmful microorganisms can be transferred to hands from contaminated surfaces that people come into contact in their daily life. Additionally, Foodnet has been reported that Salmonella, Campylobacter, and Shigella continue to be the leading causes of foodborne infections. Hand hygiene education is important to reduce the risk of diseases infections, as example by convincing people to washing their hands properly and at the appropriate time. This slide is about hand washing. Hand washing has long been recognized as a simple and cost-effective method to reduce cross-contamination and the spread of foodborne pathogens. In order to be effective, hand washing with soap and water must be combined with a rubbing process that maximizes microbe release from the skin. Despite the fact that many individuals believe they understand the significance of this easy practice for preventing illness, they regularly fail to wash their hands effectively. Moreover, an effective hand washing that has been recommended by Ministry of Health is 20 seconds, which is by washing hands with soap and water. Now, I will present on the primary factors that influence efficacy of hand washing. One of the factors is soap volume. In one study, 1 ml and 3 ml portions of antibacterial soap and a normal soap were used. According to the study's finding, an antibacterial soap would be advantageous in doses ranging from 3 ml to 5 ml, but a normal liquid hand soap would likely to be ineffective in volume larger than 1 ml. Next is hand washing time durations. CDC recommends washing hands for at least 20 seconds. This is because 20 seconds is typically viewed as adequate to remove bacteria to an acceptable level. Moreover, WHO recommends people to wash their hands for 20 seconds, which is approximate time taken to sing happy birthday twice. The other factors is drying hands. According to Foods et al., drying hands after washing is a vital step that can have a substantial impact on the overall efficacy of hand washing. Bacteria may be transferred more easily from moist or damp surfaces than from dry surfaces. This slide is about liquid hand soaps. Hand soap aids in the reduction of surface tension during the hand washing process. It enhances water-dirt soil mixing on surfaces and on the skin. Normal liquid hand soap is functioned to reduce physical removal such as soil and dirt. Next, antibacterial liquid hand soap is used for physical removal and inhibition of resident and transient microbes. The most of active ingredients are triclosan and chloroxylenol. They works by inhibits the ENR enzyme by blocking the active site, preventing the bacteria from synthesis of fatty acid, which is required for cell membrane formation and reproduction. On the other hand, there are studies have shown that consumers who use antibacterial soaps have no additional health benefits over those use normal soap. Now, let's take a look at the materials and methods used in this study. For the materials, this study will use two types of liquid hand soaps, which are normal and antibacterial. Next, for the methods, both normal and antibacterial soaps will be subjected to 3 analyses. First, to determine the efficacy between normal and antibacterial soap on hand hygiene. Participants will undergo natural inoculation, which is through contact with everyday surfaces present. Then, they will be asked to wash their hands with normal soap properly according to 7 steps recommended by MOH for 20 seconds. Then, the procedure will be continued with bacteria recovery method and enumeration of bacteria by performing total plate count (TPC). Then, the second analysis is to investigate the effect of different hand washing duration on normal and antibacterial soap on hand hygiene. Subject will be asked to perform hand washing with normal soap at first with 3 different time hand washing durations, which is 10 seconds, 20 and 30 seconds. Then TPC will be conducted. Next, this step will be repeated with antibacterial soap with the same manner. The next analysis is to observe hand contamination after in contact with fomites and food. At first, subject will be asked to perform hand washing to remove dirt, soil and bacteria that contain from their natural hands. Then they will be asked to touch mobile phones, book, raw meat and apple at different time intervals, which is for 1 minute, 5 and 10 minutes. After that, they will be perform a proper hand washing again with normal and antibacterial soap. Then total plate count will be conducted. For the statistical data, all the experiments will be performed triplicate. A one-way ANOVA will be used in this study to assess the significant differences in the calculated log reduction values of microbiome reduction data gathered from the experiment. KISS HSD test were used to determine whether multiple means were significantly different. From this study, I expected that there would be a difference in microbiome reduction between normal and antibacterial liquid hand soap. This is due to the properties of antibacterial soap that contain antibacterial agent that can affect bacterial cell activity. Moreover, antibacterial liquid hand soap also is expected to produce substantially better logs reduction than used normal liquid hand soaps at 20-second hand washing duration. Next, mobile phone is expected to be the most polluted with microorganisms. This is due to the fact that nowadays, people have been holding mobile phones for a long time and placing them on various surfaces, which resulted in mobile phones being predicted to have the highest number of bacteria. Moreover, it is expected that the number of bacteria will increase significantly at the 5th minute of holding the formats and will increase with holding time. Now, this is a slide of my Gantt chart. I intend to begin my sampling after the proposal presentation, which is in February, and to begin my analysis in March. My sample and data analysis, as predicted, can be completed between March until May. Last but not least, this is the slide that shows some of the references that I referred the most, which is mostly about hand washing, antibacterial and normal liquid hand soap, hand hygiene, foodborne disease, and methods used that related in my study.
Thank you.